It's becoming a common way of delivering babies in South Africa. More than 70% of births covered by private medical schemes in 2012 were by caesarean section. That's far higher than the US, where it's at 30%, and the UK with 26%.
I was very disappointed. I was fit and healthy and I wanted natural, and I wasn't allowed it based on the recommendations of my gynae.
They just told me that I have to go for C-section. They took me to the theater. Then they told me that I have to go for a C-section. I didn't want it.
Patti Good heads up the natural birth campaign called My Birth, My Choice. She says over 80% of women she's interviewed across South Africa prefer a natural birth. With around 400 million rand being spent annually on caesareans, Good believes many mothers are bullied into having the procedure.
The gynecologist benefit, there's a huge convenience factor. You know, if you're waiting for a mum to have a natural birth, you're kind of hanging around, whereas if you can schedule a Caesar, a natural birth actually costs the same as a C-section birth in terms of the gynaes and what they get paid, but you've then got to remember you've got volumes involved. So they can schedule X number of Caesars in a day, they cannot schedule X number of natural births in a day.
But what about medical aid schemes that are subsidizing the cost?
I think they're in bed with the doctors, and I think they're in bed with the hospital groups. And I think that to change the situation would cause such conflict that it's not worth it.
Discovery Health, one of South Africa's largest medical aid schemes, says it has engaged extensively with the country's gynecology fraternity. It's found that caesarean section is primarily the patient's choice. It's a popular choice because it allows for optimal planning and scheduling and has a lower rate of birth trauma. But Discovery Health admits that there needs to be more of a shift to natural deliveries.
Long-term health risks from a caesarean, such as allergies and respiratory disorders, are also a concern. Good is encouraging mothers to explore other options like hypnobirthing, where mothers are hypnotized to alleviate the pain. Judith Subban, Durban.